From testing to drugs that fight the virus. There are now prescription drugs for COVID-19 that will be available at Texas pharmacies. Janelle Bluta is taking a look at the 2 new drugs approved to fight COVID and why doctors are saying the vaccine is still your best option for staying healthy. Janelle.
Those drugs were recently approved by the FDA and are just now getting into pharmacies. This Walmart pharmacy is one that has them, but doctors want you to know this is not a substitute for the vaccine.
The moment you start showing symptoms, doctors say immediately get a COVID test. Because when it comes to taking these new prescription drugs, time is of the essence.
Both drugs were studied in the first 5 days of symptoms. So they need to be given in the first 5 days.
Dr. Luis Ostrowski with UT Health Houston and Memorial Hermann says there are 2 drugs now available, Paxlovid and Molnupiravir. Both are a series of pills taken over 5 days. Paxlovid is the combination of 2 drugs that fight the COVID virus together.
This drug showed a reduction in hospitalization and mortality of 89%.
The issue is that one of those drugs may not work well with your other medications.
It's a drug that will interact with many common medications that people may take.
So if you're on one of those medicines, your doctor may then prescribe you the other COVID drug, Molnupiravir. This drug works by stopping the virus.
It's a really interesting drug. It introduces errors in the transcription of the virus.
The issue with Molnupiravir is it isn't approved for children or pregnant women, and it has a less chance, only 30%, of keeping you out of the hospital.
Doesn't sound like much, but really, when you don't have any other treatments and you have somebody who's very high risk, it may be beneficial.
This is the reason you'll need a prescription. A doctor will look at your symptoms, your risk factors, and then help you decide if the drugs are right for you, vaccinated or not.
Ideally, everybody with symptoms, particularly people at high risk of severe disease, should take this medication in the first 5 days.
One more thing you should know is the drugs are just coming out, so supply is still limited. We have the information on which Walmart pharmacies offer them on our website at khou.com, but remember, you can only get them through curbside or drive-through pickup. Back to you.
Reiterating what the doctor said, the vaccine's still your best defense. Thank you, Janelle.